Colorectal cancer is usually cancers that involve the lowest part of the gastrointestinal tract, the colon, the rectum. Of the cancers, it affects both men and women. It's the second most leading cause of cancer-related deaths in the United States. It's the third most common cause of men and women. Overall, the lifetime risk of developing colorectal cancer is 1 in 20, 5% risk for everybody. Slightly lower in women, mostly 20% lower in women than in men. American Cancer Society's most recent estimates of the number of colorectal cancers will be found or discovered or diagnosed this year for 2011. It's roughly 100,000 for colon cancer, approximately 40,000 for rectal cancer. Everybody thinks it's mostly family history. I don't have to worry about it. The majority of colon cancers that are discovered are kind of what we call sporadic, and those who are average risk. No family history of colon cancer, no family history of colon polyps, no history of inflammatory bowel disease or other polyposis syndromes. 90% of cases usually occur after the age of 50. A third of these patients will actually, at the time of diagnosis, will have mortality. Approximately 61% of those diagnosed, doesn't matter on the stage of the disease, whether it's metastatic or just contained to the colon, have a 5-year survival. Only 50% of patients nationwide are actually screened for colon cancer. It's actually one of the most preventable diseases. The progression of colon cancer may start out as just normal over there on the left with a normal, nice pink colon lining, no polyps. They tend to develop into polyps, adenomas, as we see in the middle. And if left, those adenomas, 20 to 30% will actually develop into colon cancer, carcinoma. At this stage is when we want to catch them and actually resect those polyps before they develop into carcinoma. The risk factors is predominantly age. As we said, 90% of those who are diagnosed are greater than the age of 50. And it increases as we get older. Personal history of colon cancer, personal history of polyps, you're always a little bit more susceptible to developing polyps and cancer. Like we said, we want to catch it at the polypoid stage before it actually progresses into colon cancer. Those with family history of colon cancer, colon polyps, are more at risk of developing colorectal cancer. 1 or more first-degree relatives, or 2 or more second-degree relatives are actually at higher risk. Inheritance syndromes such as familial adenomatous polyposis or hereditary non-polyposis colon cancer, these are pretty rare, mostly seen in the childhood range, but it increases your chances. Like FAP, the first one, has a 100% chance of developing to colorectal cancer and usually need a colectomy by the age of 19. Racial and ethnic background increases your chances. African Americans and American Indians have a 20% chance more of developing colorectal cancer than the Caucasian population. Inflammatory bowel disease, such as Crohn's disease and ulcerative colitis. These are autoimmune inflammatory bowel disease which affects the colon. Due to their chronic inflammation, increases the chances of colorectal cancer by from 2 to 10-fold. Lifestyle-related factors, obesity, those greater than a BMI of 30 and overweight increases your chances. At this time, American Cancer Society is actually leaning towards starting screening process for the obese earlier than on the average risk. Smoking also affects increasing your chances for developing colorectal cancer. Preventative factors, medications such as aspirin and other anti-inflammatories, mostly Celebrex, has been noted to decrease your chances of developing the transition from a polyp into a colorectal cancer. We don't advise this at this time, mostly for the polyposis syndromes, but not for the average person. Dietary factors that might help prevent: fruits and vegetables, high fiber, and calcium may help reduce your risks. But the most preventive factor is actually to remove those precancerous polyps before they actually develop. And that's what's unique about colorectal cancer. It is a preventable disease. The screening guidelines right now on the average risk individuals, we usually start at 50 years of age. Recently, the American The American Gastroenterology Guidelines has changed in addition to African Americans to start at age 45. These include a single degree relative with history of colorectal cancer greater than 60, or one second degree relative. The screening guidelines at this time recommend having a colonoscopy every 10 years, depending on if there's any polyps detected or not, or recommending a flexible sigmoidoscopy or a barium enema. The CT colonography is a CAT scan that is just recently passed for every 5 years. The colonoscopy is the most definitive procedure. It actually is a direct visualization, and at that same time we can actually remove the polyps. The other three, the flexible sigmoidoscopy, the contrast enema, as well as the CT colonography, in addition to those tests, also needs to do tests that primarily detects cancer, such as fecal occult blood testing, or what we call FIT testing, a fecal immunochemical tests, or stool DNAs, which hasn't really been passed as yet. But this doesn't tell you if it's actually cancer's there. It just detects actual blood in your stool, who might predispose you to having cancer there. If any of those tests become positive or in any way, they do recommend colonoscopies, and therefore colonoscopies thereafter. High-risk individuals, these include a person having a first-degree relative with a history of colorectal cancer or even a polyp less than 60, 2 or more first-degree relatives at any age, or 2 or more second-degree relatives. Those, the high-risk individuals, are recommended to have starting their screening colonoscopies at the age of 40. And if those colonoscopies are free of any polyps, or repeated every 5 years.